Spider veins are the small, fine, red clusters of veins. They can be blue, they can be very, very fine, they can be large, they can look like hands, you know, the size of a hand. They can be anywhere on the body really, but women mainly come in, and men come in to have them treated. We see them very commonly on the outside of the thighs, above the knees. Anywhere, you can have them anywhere. The cause of spider veins is hereditary. If you choose your parents wisely, you won't get spider veins, but we don't have that choice. So it is hereditary. There's really nothing you can do through your life that's going to cause spider veins because you've inherited it, but things can aggravate it. Pregnancy can aggravate it with changes in hormones and blood circulation. If you stand for long periods of time, that can maybe increase it a little bit just because there's more gravity pressure on those areas. But otherwise, it's all inherited. We treat spider veins in different ways. We tailor our treatments to what your veins need. We will inject or do laser on the very small surface veins. And following that, we will address the feeding veins, the reticular veins that are below the surface. Not everybody is just injections on the surface veins or laser on the surface veins. We do a thorough examination before we start treatments. Dr. Vine will take a look with the ultrasound to make sure that there are no deeper serious issues going on. And if that's all clear, then we will look with our vein light. And it's a fiber optic transilluminator, and we can see below the surface of the skin. If there are feeder veins, they're called reticular veins, if those are present, those really need to be treated as well. Otherwise, they will force back into the areas on the surface and reopen them. And we inject, and you can see that flush through that vein and kind of disappear. It will come back inflamed after that, but it's a very nice procedure. It's very exciting to do. But when we use laser on spider veins, that can be again on any part of the body, from the face to, a lot of women get them on their chest or backs, but on the legs also. Patients often ask, is the laser uncomfortable? And I'll explain to them that it's light energy, so it's heat involved, but because of the small spot size of the tip of the laser, targeting the hemoglobin in the blood in that vein, it's minimally uncomfortable. There's a very slight swelling and redness afterwards, almost looks like a cat scratch, but it's very well tolerated by most of the patients, and people can tolerate it on their face and other parts of the body. It's really easy to tolerate on the leg. No local anesthetics are needed. Recovery time for sclerotherapy, with or without a laser, or with or without reticular veins, is typically around 4 to 6 weeks, sometimes a little longer. Again, individuals vary how they heal. Some people in a 4-week period between treatments will be looking terrific, all healed. Sometimes there's a little bit of bruising, sometimes there's some transient brown spots after the procedure. Some of them can last a little bit longer, and again, it varies from the patient's skin type, whether they're going to get this transient pigmentation, but eventually it does fade, or it's so light that they really don't even notice it, especially when they put a little self-tanner on. The average patient can take 3 to 5 treatments for an area of veins to resolve, and again, this is variable. We always recommend at least 2 treatments 4 weeks apart initially. The first treatment goes in and does some of the damage to those veins. The follow-up treatment will make sure that anything else that's still open will be sealed and treated. After that point, we usually have patients go away a lot longer, or they go away for the summer and they come back in the fall if there's any residual treatments to be done. But really the average area veins do take 3 to 5 treatments. It is necessary to make sure you treat these areas for long-term closure of those veins, and I think we try to be very clear about that with our patients so they have realistic expectations also. We do use compression hose as part of the treatment. We apply those to the patient at the end of the treatment, and typically, to keep the amount of time they're in compression to the shortest possible, we have them, keep them on 24 hours a day for 7 days. They sleep in them, they shower in them, they exercise in them, but then they're done. They don't have to wear them again.